Case number 1. A 3-year-old boy is brought to the emergency department with a history of sudden onset of convulsions. He has a high fever of 39 C, and there is no history of head trauma or recent illness. The convulsion lasted for 6 minutes and was generalized in nature. There is no history of prior seizures, and the child has been otherwise healthy. Based on this information, which of the following is the most likely diagnosis? A. Meningitis. B. Epilepsy. C. Simple febrile seizure. D. Complex febrile seizure. Correct answer. C. Febrile seizures occur in young children and are associated with fever, but without evidence of intracranial infection or other defined causes. The child's age, 3 years, falls within the typical age range for febrile seizures. The generalized nature of the seizure and its duration of less than 15 minutes align with the characteristics of simple febrile seizures. The absence of prior seizures and the presence of fever further support the diagnosis of a simple febrile seizure. Meningitis is less likely due to the lack of meningeal signs and symptoms and other clinical features. Epilepsy typically involves recurrent non-febrile seizures, which is not consistent with this case. Complex febrile seizure is characterized by focal features, duration over 15 minutes, or recurrence within 24 hours, none of which are present in this scenario.